Hey guys, today let's talk about dry needling. And the reason we are going to talk about dry needling is because lately it has become my treatment of choice for all kinds of shoulder problems and knee problems. Okay, it's still successful for the spine, but what I've found is dry needling really kicks extremity problems like the shoulder and the knee just out of the park. Okay, so today we're going to talk about a couple reasons what we know or why it works, and then a couple of maybe number one that I'm not exactly sure why it works, but it's kind of cool, and hopefully if someone who's smarter than me is watching this can actually kind of share with me the reason why it works, especially for the shoulder. Okay, so let's first talk about what dry needling is. Dry needling is like acupuncture, so it uses the same needles, and it actually, for the most part, uses a lot of the same spots or a lot of the same points where we actually put the needle in. The difference is kind of in the terminology and the way that we are explaining things that are getting done, because acupuncture being based in Eastern medicine really kind of has a totally different language for the health of the body, whereas dry needling centered in Western medicine really kind of resonates with me a little bit more. Even though I'm certified in both, obviously dry needling, my education is in Western medicine. As a result, it makes a whole lot more sense to me. But dry needling specifically is for muscle and joint pain of the body. Whereas sometimes with acupuncture, an acupuncturist can do X, Y, and Z that maybe is outside my scope, and it's not necessarily for muscle and joint pain. It's for something maybe organic that's not something I work on. But dry needling specifically for joint and muscle pain, which is exactly what I work on all day long. So it works out perfectly, okay? So again, same needles, same spots. Mostly the difference is in terminology in describing what we're doing. But think of dry needling as acupuncture specifically for muscle and joint pain, okay? So let's talk about what we know it does. At the site of the needle, right, the needle insertion, which is, usually where you also have your pain, it does two primary jobs that really help us make us feel a whole lot better. Number one is it speeds up blood flow. Okay, it actually does that by releasing bradykinin, nitric oxide, two chemicals that will actually vasodilate. And what we mean by that is literally make the blood vessels larger. And when you make the blood vessels a little bit larger, there can be more blood flow. And the reason why we want that for healing is in order to heal the body, you need chemicals and proteins that can reconstruct the damaged area, okay? And so the way to get that is to bring it through or into the site of the injury with blood. So if you bring more blood, you bring more proteins, more chemicals that can help heal your injured area. So number one, dry needling opens up the blood vessels and it speeds up the healing process. But secondly, it also kills pain. It kills pain actually two ways. One, let's first talk about how it kills pain at the site of the injury or at the site of the needle insertion, okay? You have two types of nerve fibers we're gonna talk about right now. One is one that senses pain, and the other one senses touch. Think of the one that senses pain as like the younger brother, smaller, thinner, it's kind of scrawnier compared to the touch sensing nerve fiber, which is big and strong. It's the older brother, okay? And what the older brother can do is it can physically out-muscle the younger, smaller, pain-sensing nerve fiber. So if there is a gate, we call it the gate theory of pain. If there is a gate that all nerve sensations, sensations of the body have to pass through in order to get to your brain, it's got to go through this one little gate. If you flood that gate with information, specifically touch sensation, like the touch or the feel of that needle, you flood that area, there is physically no room for that pain signal. So pain is literally knocked out by flooding the brain with a touch stimulus. It's the exact same reason why if you bump your head or you stub your toe, the first thing you do is you grab that area and you start to rub it, because you're activating all of these nerve fibers that sense touch, kills pain. Okay, so the other reason, or the other thing that it does to kill pain is it actually releases endorphins and enkephalins in your brain, which are like the natural opiates of your body, right? So if you need to kill pain, your body releases endorphins and enkephalins, and it knocks pain down. So dry needling physically helps your body and helps your brain release these chemicals to kill some pain, all right? Those are the things that we really are confident about. What does dry needling do? Why does it work? Why is it so successful with our musculoskeletal conditions? Now, I'm going to talk about one that is probably the biggest deal with a lot of my athletes here in the office, that I don't really have an explanation as to why it works. It just works, and it's super cool that it does. All right. If anyone's smarter than me, understands this a little bit better, that's watching this video, please let me know so I have a better explanation for my patients. All right. But most importantly, somehow it is really helping range of motion. So a lot of my shoulder complaint patients, so my overhead athletes, tennis players, even golfers, pitchers, or even anyone who works out in the gym, think of the snatch motion, any kind of overhead squat where there's a barbell over your head. We injure our shoulders a lot, right? So a lot of these athletes, they're coming in and they can barely move the shoulder. Maybe they can't even bring the arm up to parallel with the ground. We'll throw some needles in. Not only does it kill pain, but they'll come up off the table and they're like, oh my gosh, doc, look how well my arm moves. And they've got almost complete range of motion back in their shoulder, right? Which is super cool. I don't have every explanation for everything that we can do. That's pretty awesome. And so if you're watching, you know the answer, please tell me. But the three main things that we get with dry needling here in the office is increased blood flow, so we get better healing, we get pain relief, and we get an increase in range of motion, which is awesome. So if you're struggling with any of those kind of problems, if you got any knee or shoulder problems, let me know. Always reach out, ask me any questions that you may have, and always remember to live with passion, not pain.